Lenvatinib Everolimus combination is a very interesting, needed therapy option for our patients with advanced RCC in the refractory setting. I had the privilege of being involved with the development of that drug from its phase 1 start and have had the chance to treat many patients with that combination. I've been very pleased with the degree of activity of its ability to produce responses that are durable and with reasonable quality of life in the second, third, and fourth line setting. The phase 2 trial that ultimately resulted in regulatory approval in the United States was a trial that randomized patients in the second line setting. So these patients had had prior frontline VEGF inhibitor, mainly sunitinib or pazopanib, and they were randomized to receive everolimus, which had been recognized as a standard refractory agent globally, or to lenvatinib as a single agent, or to the combination of lenvatinib and everolimus. The trial enrolled roughly 50 patients per arm. The primary endpoint of the trial was progression-free survival. Secondary endpoints included objective response rate, tolerability, and overall survival. We were pleased to report from the phase 2 results and also publish the results showing that all 3 efficacy endpoints were met. Objective tumor response rate was much higher, overall survival benefit was seen, and a progression-free survival was higher than we had seen yet in a refractory patient population. For that reason, and the general tolerability of the agent, the combination received regulatory approval by the FDA and has become now one of the main therapies that we choose for our patients in that second, third, and fourth line space. The next stop in development for lenvatinib and everolimus was to move in the frontline setting, comparing that regimen versus a combination of lenvatinib and pembro versus sunitinib. And that is a trial called the CLEAR study. I'm on the steering committee for that trial, and that trial is accruing patients right now. So we hope for in the next 1 to 2 years to have high-level data to present at one of our future meetings.
It's been my personal experience that the combination of lenvatinib plus everolimus is a highly tolerated combination in which we see few side effects that are unexpected, especially when we think about combination therapy. We always get worried that we're adding 2 different medications together and then there's some sort of interaction between those 2 medications which lead to unexpected toxicities. In this combination, because these 2 medications are very well tolerated and don't interact from a toxicity standpoint, the toxicities that are seen are very similar to just single agent lenvatinib and single agent everolimus. But more so, in addition to tolerability, is also efficacy. What I've seen is promising results by using the combination. In fact, we also see for patients in which they've gotten lenvatinib alone, the addition of everolimus has led to additional clinical benefit. Similarly, for patients that have gotten everolimus alone and progressed, the addition of lenvatinib also seems to provide clinical benefit.